Hiya, so this video will go through first, second, third degree blocks and kind of follows on from the last video where we talked about rule 3 and if there's an abnormality detected there, where we've got a long PR interval and what that means. So hopefully we'll be able to go through the normal cardiac conduction, what you'll see on the ECG, and then an easy way to remember which block is which. So the normal cardiac conduction is you've got the SA node as your dominant pacemaker cell. It sends the depolarization energy through the atria, meets it at the AV node. AV node then propagates it through to the bundle of His and into your Purkinje fibers and your ventricles to cause that contraction. Something that happens here that's important, and you'll see why later on, is you've got the AV node holds that charge momentarily. So what it does is it holds it for a millisecond or two, and this allows for the atria to fully contract all the blood into the ventricles. So what you see on the ECG is you see your P wave and then you see a short pause. And that short pause, like that's flat line being the isoelectric line, is where the charge is held, just for note. So without that there, obviously it wouldn't be coordinated and wouldn't do what it needed to do. So that's kind of the normal cardiac conduction pathway there. Something important to note with this cardiac conduction pathway is you've got something called intrinsic rates. So the intrinsic rates are the rates that each level of that are happiest kind of depolarizing at. So your SA node depolarizes at a rate of about 60 to 100 there, and it does that on its own. If for any reason though that fails or gets blocked, completely blocked, the AV node can take over. However, the AV node, as you go further down the chain, gets slower and slower. So the AV node can depolarize at a rate of about 40 to 60. And then as you go down further, so if there's a block at the AV node and the ventricles need to take over, they depolarize at a rate of about 20 to 40. So you'll see as we go on how that impacts the first, second or third degree block. And the reason it does that kind of as a backup, because if the block is there and there's no electrical depolarization getting through, it's kind of like a last-ditch effort by the ventricles to create some sort of depolarization there. You've got your ECG and you see that there's quite a distance, or you see in the little number at the top that there's a PR interval over 0.20. The next kind of step to do is print a really, really long rhythm strip. And this long rhythm strip will help you to mark out the P's and the QRS correlation, because that's what all these, identifying these blocks is about how correlated they are. So you print off your long rhythm strip and you just see a constant distance between the P and the QRS. So that's like over 0.20. This is just really simply a first degree block. There's just distance there. So this can be quite common, and in the pre-hospital field it's not significant on its own. So that in isolation doesn't mean that the patient needs cardiac investigation or needs hospital. That's quite simple to get your head around. Moving on, you've got second degree. So within second degree, there's second degree type 1 and type 2. So second degree type 1, again, we go back to the P to the QRS relationship. There's a progressive prolongation, so they're getting further and further apart, and then eventually a QRS drops, or it's absent. It looks like it should be there and it's just not there. So what this is it's progressive fatigue of the AV node. It's getting tighter, 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 and then it fails to propagate the depolarization there. What you'll commonly see after that as well is you'll see the next PR interval will be the shortest one, and then it gets longer and longer and longer and goes from there. So that's second degree type 1. So with second degree type 1, it's similar with the clinical significance of a first degree block, where it doesn't, in isolation, it doesn't need further cardiac investigation. It can just be something that people have on the ECG, a dropped beat or what have you. Second degree type 2 and third degree, where we're moving on to this other half, these both are an abnormality and that need cardiac investigation, they're quite a high risk patient. So second degree type 2 is where we have an unexpected failure. So you have everything looks like a normal sinus rhythm, and then all of a sudden there's a missing QRS. It just looks like it's dropped or it's not there. These patients need investigation because they are quite highly likely to go into a third degree block, and obviously that triggers our kind of cardiac care pathway for an arrhythmia centre, and they're quite unwell, these patients in a third degree block. So third degree block, also known as complete heart block, is there's a complete block there, so no depolarizations are getting from the SA node down into the ventricles. So the SA node, or the atria and the ventricles, are kind of working independently. They're not working together, and there's no messages that are being exchanged appropriately. Something too important to notice when you're marking out and you're looking at this long rhythm strip, what you might see is a misshapen or an odd T wave. If you see misshapen T waves, or you see something that just doesn't look right, what that can actually be is you can have a P wave hidden underneath it. So if you see one T wave out of 4 or 5 that just looks a bit odd, it's misshapen, it's lumpy or something like that, that's usually more than likely a P wave that's hidden underneath there. So include that when you're counting them out. So typically, because we're down near the ventricles now, you should see them in the region of about 20 to 40. With these patients, they can present quite well and seem okay, but a lot of the time they do present sweaty, chest pain, they look really unwell. If you look at your patient, they're very, very unstable. You can obviously follow pathway for atropine and things like that, but it's also important at this point to start considering if you need someone to pace these patients, because when you do move them, there is that risk that they decline quite substantially. So that's just something to consider for your third-degree patients. Talking about blocks with students, one of the most common themes is that they got a little bit confused about second degree, type 1, type 2 and third degree, and differentiating between. One of the most useful things that I had a cardiologist explain to me was about an analogy of how blocks are like a marriage. So it might sound a bit odd, but it kind of just stuck with me. So what it is first degree is about, and the P and the QRS are kind of in a marriage together. They're in a relationship. First degree block, you've just got distance between the two. Second degree type 1, they have a growing distance. They get further and further apart until eventually they get a separation, or they get apart from each other. And that's where the QRS is missing. The next bit, and how I link it into your second degree type 2, is after a separation, sometimes they're together and then sometimes they're not together. So sometimes you've got a P and a QRS perfectly together, and then sometimes there's no correlation between it. And then a third degree is basically like a complete divorce. So a third degree is that there is no correlation. The P's don't create a QRS, and they're not kind of talking to each other in any way. They're acting independently. They're divorced, they're separated, and very much apart. So you may sometimes see, as I said, that they look together, but it's purely just by coincidence that they've kind of run into each other, should we call it. So that analogy kind of helps make it simple when I'm looking at it. If you go through it a few times and you write it out once or twice, it should hopefully stick with you, and linking that the second degree type 1 to second degree type 2 of the separation there. So just going through that analogy again, you've got first degree is there's just distance. Second degree type 1 is they're getting further and further apart, and then they get a separation. And again, that cycle repeats. And then after a separation, which is the linking way to the second degree type 2, sometimes they're together, sometimes they're not together. And then third degree, being the divorce, is you've got no correlation between the two. So hopefully that it helped explain first, second, third degree blocks. And yeah, cheers.